our agenda today is really, we want to really get this time with you to learn from you. We are here and we are convening this conversation to talk about our Better Together strategy. And one of the things I would like to do is for everybody to introduce yourself on the chat, just by telling us your name, organization, and what you're perhaps hoping to get here today. But the goal here is we're going to go over the racial equity justice system across the network very briefly. Then we're going to be introducing you to the racial equity and cultural humanity reach. And we're going to be, because again, this is a learning session, we are going to be breaking out in groups and we're going to be hearing from you. Because based on this feedback, we are going to be building our trainings, and what we are here to do as a New England Mental Health TTC is get to hear what your needs are so we can provide a much better training and technical assistance for your teams. And we see a variety of people, so please use the chat as we move forward so we know who's in the room. Let me tell you a little bit about the New England Mental Health TTC. So as this is a network, that's a national network, and we are the New England Region 1 Mental Health TTC. We are one of the 10 regional centers. There's also 2 additional centers that are across national, one from Latino Hispanics and the other one for Native American, Asian, Pacific Islanders. The mission of our mental health TTC is to really disseminate evidence-based practice across the New England region. And our area of expertise is recovery-oriented practices. As you saw in the language slide, we really value and believe in the power of people to live fulfilling lives, regardless of where they are. In terms of our principles and all the activities we do, and this will not be any different for our Advancing Racial Equity initiative, is we are guiding principles that we believe fire and foremost about resilience and recovery. We believe in respecting individuals and families, understanding that resilience and recovery are coming from a hope place, is person and family driven. There are many ways of, they are influenced by culture, and they are supported by addressing trauma. So in all of our activities, and when we are talking about racial equity, we are going to be actually including these principles in all the activities that we do as a New England Mental Health TTC. Lastly, it's very important for you to understand how, because we're going to be presenting you the Better Together strategic initiative and some of the components. As a New England, as a network, the whole national network believes in, we provide 3 levels of activities, training and technical assistance. The first one is the universal technical assistance. We provide, if you are not on our mailing list or would like to subscribe, please do so. We provide publications, information, everything on our website is free. That's the universal messaging that we do as a network. Then we have targeted technical assistance that's really provided specific webinars and topics that are coming from the needs of the community. And then we have the intense technical assistance that is more of an ongoing and takes the shape of learning community for a longer period of time. And what it does is you provide individualized technical assistance. This is all free of charge, of course, for your agency. And under all of this, we believe in the cultural and linguistic appropriateness of the services. So as a network, it's very important to understand that we are completely committed to advancing health equity. That means that everybody who has a fair and opportunity to be as healthy as possible. And, when it comes, especially in particular for people with behavioral health conditions. So we provide a lot of trainings, and every mental health TTC is really embracing. There is a cultural responsiveness group, there is a mental health equity group, but then each individual center has their own commitment and urgency to actually address these needs of health equity. So Ingrid?
Absolutely. So given all of this, we're happy to kind of share with you our vision. We really want to work within our region to build community, to hear your stories, to learn more about your needs, and really to help you create equitable partnerships and lasting relationships. And we know now that there's a compelling and urgent need for this. If we go to the next slide, you'll see a quote that's actually from SAMHSA's Office of Behavioral Health Equity. So let's read it together. It notes that the COVID-19 pandemic, economic crisis, and widespread racially focused protests have highlighted glaring inequities for racial and ethnic minority communities. These crises have significant implications for mental health and exacerbate already poor access to behavioral health services in BIPOC communities. So given this compelling and urgent need, we kind of see this as a call to action and really want to assist you and your organizations and agencies as you examine how societal issues, particularly those within mental health care and other systems of care, are impacted by disparities, racism, and inequality. So with that, let's take a little poll. Tell us, is your organization currently working on addressing social or racial equity and social justice issues? And if so, maybe share in the chat what you're doing. See, someone's training counselors on implicit bias. That's great. Looks like a lot of you are doing work in your communities. Ready to share results? Oh, that's great. So 85% of you are doing great work in your communities. A few, hopefully, no matter where you are on this journey, we'd like to be of assistance to you. Do you want to say a little more, Maria?
Absolutely, because this is fabulous. What we want, and I see a diverse group of people today. One of the things that's important to understand that this is a journey, and what we're inviting here today is for you to take a seat on our learning community, because we are all going through this journey. As a New England Mental Health TTC, we ourselves recommitted to this social justice principle. So we are learning together ourselves. And then in addition to this, we are putting this initiative out. So we are going to be studying when we join, if you join us in this effort, starting from what you are already doing well, that's working well. And that's when the individualized experience is going to be very important for you. So we will tailor that, but we are delighted to know that you are already on the way and that your agency is committed to. I think this is a critical time for all of us, and we need everybody on the table.
So as Maria said, our learning community is really grounded in our principles of recovery and designed to support the workforce, supporting behavioral health needs in New England. There are 3 ways to engage: our universal, targeted, and intensive training efforts. So if you go to the next slide, we can walk through each of those. So our universal supports are designed to help you increase your overall awareness around this topic. And over the course of typically a 3 to 6 month period, that would provide you with access to publications and resources, invitations to join and engage with our network via Basecamp and other platforms for learning. The targeted approach would be more of a kind of opportunity for you to gain and really apply basic knowledge, perhaps over the course of 6 to 12 months. And so what does that look like? Individualized technical assistance, access to other learning communities and collaboratives throughout the New England MHTTC, and then networking and ally development support through our BIPOC resource directory. And so now let's turn to Maria for more information on our intensive training opportunity, which is Reach for Organizational Change.
As I see in the chat, I mean, people are doing already fabulous work. From updating HR policies, from creating an anti-racist working group. We have the same thing in our staff. Creating a race equity council. So these are all great ideas. So what our learning community, what we're hoping to do today is, and then please the next slide, Dana, is to really understand that, again, as I said before, this is really a journey. And If some of you are already in the journey, then there's always room for improvement. So what we do through an intensive training assistant learning collaborative is really we're going to be formalizing. We're going to do some training. You know, it's important for all of us to always keep learning new concepts. But we are really going to be, this will give you an opportunity for you to bring a team together from your agency. So for example, I see Latoya is with the prisoner system in Massachusetts. So probably the needs of the community that she's working with are going to be very different from somebody who is perhaps working in the community. So what we believe and what we know is found is to really bridge the gap between training and application. And when we join a more intensive training and technical assistant activity, what we do is we are going to be providing a lot of monthly consultations to with your team and really provide specific strategies that are going to be really help you advance the mission of the organization. So this is going to be a journey that's going to take a longer time. That's what is an intense activity. And the next one, because it's going to be high individualized consultation, we're going to be providing feedback. We're going to have and connect you with access experts. So for instance, if you already have a racial committee, like some of you said, for example, then we could also partner with you with somebody else. And the idea is to really promote cross collaboration together within the New England region. You know, specific examples could be, as you are describing, talk about the hiring, increasing more training to increase the skill set of some of the people in your program, redesigning policies. All of this clearly we are always provided to CEUs. So anyone who wants to become a member of this learning collaborative will have an opportunity to really reach out to extensive network, and especially for all of our faculty today. So what we want to do next is, this is just a very brief overview, but we really wanted to get together and hear from you. I see we have a total of 23 people in the room, which is fantastic. We're going to be doing some breakout rooms. In each of the rooms, we're going to have two members of our team, the ones I introduced you earlier on, and we're going to be asking you 3 questions, and we want to learn from you, because this is the way everything has to be individualized. We understand you are committed to advancing this mission. We want to understand what's going to be best for the community in New England. So